Hi, my name is Alsafa, and my presentation is about information systems in healthcare. Let me start off with a little story. So imagine you went out for a run, and suddenly, while running, you collapsed. And the next thing you know is that you're being rushed into the emergency room. When the nurse at the emergency department gets a call about you coming in, the first thing that the nurse would probably do is file in some treatment documentation, reserve a bed for you, and document the estimated time that you will be spending at the hospital. Now you might be wondering, how does she record all that information? Well, all that is done through the information systems that are provided to the hospital. The next step of the process is you reaching the hospital. When you arrive, the staff would probably question you about your symptoms and get a basic understanding of how you're feeling and what disease or whatever it is that's happening to you is. The nurse will record the information that you provide in some files on their computers. So it saves time and you can be treated as fast as possible. The information system is called an EMR, which is also known as electronic medical records. And EMR is also used in almost all of the hospitals in Canada. And it stores all your medical information and your medical history. So through the use of an EMR or an EHR, which is an electronic health record, and an EHR includes more of the health data and the test results and the treatments, your previous treatments. And these two terms are used interchangeably. So when the doctor comes in for a checkup, he or she will be able to review all your previous tests, your health data, and the treatments you've gone through. And based on all that information, the doctor can start the treatment immediately. Any test that's being done on you will always be recorded, so in the future, if you have any problems, the doctor will be able to come up with a solution and see that you've done these tests in the past. With the help of technologies in healthcare, you can see how fast the process would take, and your treatment would start even before you get to the hospital. Compared to back in the days when they had to write all the information on a pen and a paper about the patients, and that would take ages to come up again. Another good thing about information systems is that now you can view your test results and your personal health data, such as your next appointment information, your medications, and your prescriptions for your medications through patient portals. So you won't actually need to come to the hospital to review your test results unless there is an absolute emergency. Health information systems also have many benefits to it, such as data analytics, which helps you gather and analyze some health information to manage the population and reduce some healthcare costs. The health data analysis job is simply to improve patient care. Another benefit is cost control. With everything now being on a digital platform, when the regional markets use these health information strategies to share some data, the healthcare providers see some reduced costs. And this was my presentation on how information system is used in healthcare. And these are the citations for the pictures that were used in this presentation. Thank you.